Hello everyone, I'm presenting our study regarding experience of Botox treatment in Detrusor overactivity with less number of injections. My name is Habib. Myself and my other two co-authors, we work in London North West University Healthcare NHS Trust. As we know, the Botox injection is an established treatment for overactive bladder. However, the modern trend is moving towards giving this injection under local anesthetic in outpatient setting. But some patients find difficult to tolerate the standard 20 injections technique under local anesthetic in outpatient clinic. Therefore, to reduce the pain and discomfort of 20 injections, we tried alternate 7 injections technique and checked its safety and efficacy. This was a prospective study involving overactive bladder patients. They were offered intra-Detrusor Botox injection after failed or unable to tolerate medical treatment. All procedures were performed under local anesthetic using flexible cystoscope in outpatient clinic. The Botox was diluted with 10 ml of normal saline and administered as 7 intra-Detrusor injections, as 3 in the midline and 2 on either side. The symptoms were assessed with ICIQ-OAB, ICIQ urinary incontinence questionnaire before treatment and at follow-up in 6 weeks. Complications and outcomes were also noted at follow-ups. Paired t-test was done to check for statistical significance. Here you can see these the injection technique, the 3 in the midline and 2 on either side, 7 in total. Regarding the result, as we expected, majority of the patients were female, more than 60%, and we can see the outcome of the validated questionnaire. All the parameters ICIQ-OAB, ICIQ-OAB Bladder score, and ICIQ urinary incontinence, the patients showed remarkable improvement in terms of the symptoms, and statistically all the parameters were significant. The p-value were less than 0.01. Majority of the patients, about 76% had idiopathic Detrusor overactivity. Less than 20% had neurogenic Detrusor overactivity, and only 7% patients had sensory urgency. More than 80% patients were happy with the symptomatic improvement and continued further Botox injections. As we can see, 30% patients were doing intermittent self-catheter. However, only 10% patients commenced self-catheter after having Botox. So 20% of them were doing intermittent self-catheter even before having the Botox injection. But it's interesting to see, after 1 month, 2 out of 5 did not require to continue intermittent self-catheter. So therefore, about only 5% patients continued intermittent self-catheter as a long term after having Botox injection. One patient came back with urinary infection, but no patient had retention or hematuria. Regarding interpretation of the result, there was significant symptomatic improvement in all validated questionnaire, but also importantly, the overall success was comparable with current literature involving standard 20 injection techniques. Therefore, this reduced number of injection treatment was not inferior to. So, in conclusion, what we can say, the 7 injections are safe and effective, and it was comparable in terms of outcome with the standard 20 injections technique. So we can recommend the 7 injections technique for Botox treatment in outpatient setting under local anesthetic. Thank you.